Welcome, Nebraska, to Networking with NIFA. It is Wednesday, June 10th. It's good to see everybody, or I know you're out there. We've been doing these webinars and we've had some great feedback, so we're really excited to offer these to you. My name is John Turner and I work at NIFA. Also from NIFA today, we have Robin Ambrose. She'll be managing the controls, and Elizabeth Fimbreeze. So all three of us will be managing this and taking your questions. So remember, if you've done this before, we do have a question feature that you can submit, and we will process those throughout the presentation and leave time at the end for questions. Just some housekeeping stuff. We do have these webinars that we're doing now. Today's Networking with NIFA. Next week we have Conference Connections, which was inspired by our annual Housing Innovation Marketplace Conference, which obviously we had to cancel this year. So next week, June 17th, will be on factory-built homes, and that was a session we had planned for our conference. You can also find that information on our website, nifa.org. Also, this is Home Ownership Month, and we have a Facebook contest. So you definitely want to log on to our Facebook page and follow the guidance there, and you might be a lucky winner. All right, well, so today I'm very excited. Coordinated entry is a fantastic intervention that we have throughout the country, but Nebraska has really stood out nationally as a very collaborative group that is working together to end homelessness. And today we have three experts to really go into detail about how amazing this program is. So today we have Jeff Chambers and Denise Packard from University of Nebraska-Lincoln Center on Children, Families, and the Law, and Randy McCoy from the Omaha metro area Continuum of Care for the Homeless. So without further ado, I'm going to pass it on to Jeff. Thank you guys for being here.
Thanks, John, and thank you everybody for joining us today and the opportunity to talk a little bit about coordinated entry in Nebraska. As John mentioned, I'm Jeff Chambers, Project Director at the University of Nebraska-Lincoln Center on Children, Families, and the Law. I'm going to talk a little bit about coordinated entry generally, and then Randy McCoy, the Executive Director from the Omaha metro area Continuum of Care on Homelessness, is going to talk about the work that is going on in Omaha related to coordinated entry. And then we're going to have Denise Packard, the coordinated entry manager at UNL, that covers Lincoln and the balance of state outside of Omaha, talk about how it works in the details. So thanks again. And next slide, please, Denise. So what is coordinated entry? And I'm just going to you can see it on your slide there, but coordinated entry is a process developed to ensure that all people experiencing homelessness, a housing crisis, have fair and equal access and are quickly identified, assessed, referred, and connected to a housing assistance based on their strengths and their needs. This was, coordinated entry was a mandated effort out of the U.S. Department of Housing and Urban Development. I think originally started back in 2011, 2012, right after the ERA Homeless Prevention and Rapid Rehousing Project ended, and some of the lessons learned out of that, which really kick-started coordinated entry for homeless service systems across the country. In Lincoln and the balance of state, and balance of state again is everything outside of Omaha and the city of Lincoln. We began implementing coordinated entry in 2014 for our permanent supportive housing and rapid rehousing projects. And we've recently added then a list for transitional housing, and we are in the process of incorporating homeless assistance prevention into coordinated entry. So next slide, please, Denise. So this is a nice, just really basic graphic that Denise put together that describes what our homeless service system looked like before coordinated entry and what it's like now with coordinated entry. So before, individuals experiencing a housing crisis would present at a provider in their community or be referred to that provider. And that provider would look at that individual, see what their needs were, look at their own array of services within their agency and determine, can we help this person or can we not help this person? If they could not help that individual in housing crisis, they may refer them on to a different agency, or they may say, you'll have to go somewhere else to solve your problem with housing. And then if they were able to help that person and they did have a program, it's whatever program they had in-house. It may or may not be the best fit for that particular individual's housing crisis or situation, but it's what was available. There was also the ability for agencies then to determine, based on internal criteria, who we're going to serve with our programming and who we're not going to serve with our programming. There was also the issue before coordinated entry of, if I showed up in an agency with this particular housing crisis and the guy behind me showed up with a different housing crisis, if I'm in front of him in the line, I'm more likely to be able to get their programming than the person behind me, even though the person behind me may be a better fit for that particular programming. So that was and the onus was on the individual in the housing crisis to go throughout the community to find what's going to help me become stable in my housing. It was not on the system to help determine that. So that was before coordinated entry. After coordinated entry now, people continue to show up with a housing crisis at agencies and community-based agencies throughout the community. But each one of those individuals is assessed in a common manner. So everyone is asked the same questions, their needs and their assistance need is asked consistently across the state, in effect, or across the continuum. And then all those assessments are then referred directly to coordinated entry. And within coordinated entry, a process of prioritization, determining what's the best housing solution for this individual is determined, and referrals are then made out to providers throughout the community. So it doesn't matter which provider you present at, coordinated entry tries to find the most effective and efficient housing solution for your particular problem, no matter where it's at in the community. So in a nutshell, that is what it was like before, and that is what it is like now. A couple things to keep in mind. Generally in the housing service arena, there is the expectation that a certain percentage of the population will solve their housing crisis with little or no additional assistance from the formal homeless service system. Then the numbers thrown around about 20 to 25%. Those can vary, but many folks will be able to solve their housing crisis without further assistance from the system. There are many folks in housing crisis that there is no possible way that they can identify that solution and fulfill a solution to their housing crisis. And what coordinated entry also does is then prioritize those from those that need the system's help to solve, and there is no other option, to those that are very likely to be able to solve their housing crisis with minimal or no assistance from the system. So next slide, please, Denise. And this is just another graphic for particularly the Lincoln housing crisis response system. So persons in housing crisis or needing housing assistance present across the community, what we call a no wrong door approach. All that information is then funneled in through intakes and the assessments and the prioritization process through All Doors Lead Home. And through that prioritization process and the availability of housing throughout the community, referrals are made out, or providers are able to access that information to determine who's the best fit for my program throughout the community, no matter where they presented. And some of the major streams of services systems assistance are shown there. Diversion, trying to maintain people in their housing that have not yet become literally homeless is critical to our system. Two of the primary housing programs within our system are rapid rehousing and permanent supportive housing. And then another large component of coordinated entry that we're just now integrating is prevention assistance, which is a type of diversion, or which is diversion is a type of, that provides rent and utility assistance, again, to maintain individuals within their households, within their current housing. Next slide, please, Denise. So some of the key elements of any homeless, or most, and I think Randy would agree when he's talking about the Omaha system of coordinated entry systems, at least in Nebraska, is no wrong door access. I've mentioned this a couple times already. It doesn't matter where you present with a housing crisis in our continuum, you are going to be able to be referred to the entire system. That's critically important, particularly in a rural continuum of care like the balance of state. That's very important. All Doors Lead Home, or our coordinated entry system, uses the homeless management information system as the data and the engine hub for all of this work. And Denise is going to show us a little bit about that coming up. Common assessment. Everyone has to be assessed in exactly the same way for us to be able to legitimately and accurately identify that this person is a higher priority than this person, and this is the right type of housing program for that individual. And that was a huge change for the continuums, for everybody to collect the exact same assessment in housing assistance. We have a standardized system of prioritizing needs for the limited resources. Again, that's that prioritization process that Denise is going to talk about in a little bit. We have a by name list. So everyone that's referred is prioritized, and then they're put on the by name list from highest priority to lowest priority. And there is providers through homeless or housing providers throughout the state are able to access that by name list as they have program openings to determine this is the highest priority person that is appropriate for my program. Let me see if I can work with that individual and get them housed. They have 24/7 access to that list. And then also another important element in coordinated entry is periodic case file review and guidance from the entire continuum and from stakeholders on individual cases. And Denise might talk about a little bit more about that. But in the balance of state in Lincoln, I think in Omaha as well, the by name list is reviewed weekly. So that's a very important process as well. Next slide, Denise. Okay, I talked, and I'm just going to briefly touch on this so we can move on to Randy and Denise, is that we're now incorporating with lots of resources coming into our state because of the COVID and the economic crisis from that. Homeless and housing assistance, prevention assistance is critical moving forward. We are incorporating prevention assistance into the coordinated entry system in Lincoln and balance of state. And you can see on your screen there that those are the primary components of that. And they're very similar in terms of what I just described for the entire All Doors Lead Home process, except it's not so much a prioritization at this point, it's a triage, who's the most appropriate. If you need rent assistance, you need rent assistance. There's really no priority. I mean, the prioritization of that, particularly with the resources that are coming in the near future, at least, are going to be less relevant. But it's a triage. Are you appropriate for prevention assistance? Will prevention assistance actually end your housing crisis? And if it will simply prolong it a month, there might be other options or better processes that we should recommend to end that housing crisis. Next slide, please, Denise. As a part of that, one thing we're really excited about in Lincoln is that we've been able to work with a community foundation to develop basically a common fund to pool multiple resources of prevention and assistance into a single fund where everyone in the community has access to that common fund, and it's not specific to a program or agency in the community. All those agencies can tap into that common fund. And that's really a change in the system of providing prevention assistance. Omaha, I know, has had a common fund for quite some time, and I think Lincoln is getting there. And I really think it's going to improve some of our ability to provide very quick, as needed prevention assistance. And I think, Randy, I'm going to turn it over to you at this point.
Hi, good morning, everybody. Thank you for being here. I am Randy McCoy. I'm the Executive Director of MATCH, the Metro Area Continuum of Care for the Homeless. We service Douglas and Sarpy counties in Nebraska and Potawatomi County in Iowa. We have a coordinated entry system very similar to what Jeff was talking about for Lincoln and the balance of state. Omaha's was developed about the same time frame originally. But we went through a major overhaul in 2018, and that happens every once in a while. You can build a system, but you have to watch it, track it. There are changes to be made, and so we went through that in 2018, and continue to monitor it and see how everything is going. The next slide, please. So just like Jeff said, it is to ensure a standardized assessment, to make sure that we are prioritizing people based on their individual needs for the appropriate housing or services that our community has to offer, working on ensuring equal access, and to cover all three of the counties that we serve in the Omaha metro area. The other thing is that we want to make sure that we produce really good data that we can use to analyze the needs in the community and what the system needs to do to improve. We'll talk about that in a little more detail in just a second. Go ahead, please. So what we know in terms of system data, and this is for 2019, is that each month an average of just under 2,000 people present somewhere within our system and indicate that they are homeless on that day. Over the course of each month, we have just over 3,000 households that have identified as homeless, and so those would be people staying in shelters or maybe unsheltered, staying on the streets, or are just those new connections each month. And then we know that about 1,200 people exit homelessness every month. And so they are going to new permanent housing destinations or apartments, whether it's through a supportive housing program and have been connected because of prioritization, like Jeff was talking about, or they have found a friend or a family member to live with, or they have found a way to get housing on their own. Now you would look at what we call the inflow, right? The 1,900 people a month that come into the system, and the outflow, or the number of people who leave, and you're like, wow, why aren't there this exponential growth of people who are homeless over time? And it kind of goes back to what Jeff was mentioning earlier. There is this number or percentage of the population that may present somewhere at a coordinated entry access point and say, I don't have a place to stay tonight, but we'll figure it out on their own with very little or no assistance from the system. And so they may never stay in a shelter, they may never sleep on the street, but at some point there was a contact that indicated that they were homeless. And so there's this number each month that they become inactive. So they connected to the system at one point, you collected the information on them in assessment, but they never really needed assistance or needed what the services were. Next slide, please. So when we look at our inflow, or the number of people presenting on a monthly basis, one of the things that we kind of realized was that each month, the average is 487 households who are new to homelessness, which means that either they have never experienced homelessness before, or it's been for a period of longer than 2 years since they last had a housing crisis and may have been literally homeless. And that 8 of those people presenting at an access point each month are returning to homelessness. So they've been homeless before, accessed some housing option, whether it was through a supported housing program or something else, but they are coming back. This is really important for us to kind of get a hold on, and as Jeff was talking about the prevention piece, this is where you kind of plug those things in. And so we know that there's this population who are new to homelessness every month, and the question then becomes, if we build in prevention efforts or diversion efforts into our coordinated entry system, how many of those people can we prevent or keep from becoming homeless on a monthly basis? Next slide, please. Next slide. Excellent. So in Omaha, could we go back there? In Omaha, our prevention kind of build out, we call it housing problem solving. And basically it's the pieces that Jeff was talking about. It includes prevention. So do you need rental assistance or something like that? It includes diversion, which means someone shows up and says, I don't know where I'm going to stay tonight. I think I need to go into a shelter. And there's a conversation that happens that says, what are your other alternatives? What resources or strengths do you have? And where possibly could you go that isn't a shelter? And then, of course, rapid exits from shelter. So we couldn't identify a place for you to stay tonight, so you had to go into a shelter. But what are your options, or what options exist for you? These conversations that we have with people are strengths-based conversations. What assets do you have? What resources do you have? What plan or what do you want to do? And we work to identify those alternate options. And we connect them to other supportive services. And so if you need to apply for general assistance, or if you think you want to apply for housing through a housing authority or a Section 8 voucher or something like that, making sure those connections are made. At the end of the day, the project does have financial assistance. And so if we're having that initial conversation and you do have a place to go, or you do have a housing option, but you just need, first month's rent or a deposit or whatever it is, the program will provide that so that we can get you back into housing and not into a shelter or not into a homeless situation. Yep, sorry.
The slide won't advance for me. There we go. All right, thank you, Randy. Jeff said that I'm the coordinated entry manager, and the coverage area that I help with is the balance of state. So I just wanted to take a minute to go through and show you kind of what we look at. When people hit our system, we look at where are they going afterwards. And so here's a chart to show you, give you some examples of how many people are going into rentals without subsidies, permanent supportive. And as you can see in the balance of state, on the 249, that big spike up on that chart, we have a lot of rapid rehousing, and a lot of connections to rapid rehousing are being made within the balance of state. We have limited permanent supportive housing out there. So this is for 2019 to May 31st of 2020. Just a handful went into permanent supportive housing. But otherwise, we're constantly trying to look for what are some other solutions, maybe if there's a gap where someone doesn't have a rapid opportunity and things like that. And our team meets every Thursday where we case conference this and try to get creative with solutions. We even had someone from one of the shelters that had just gotten a job, and the advocate talked with the boss, and they covered the first month's rent and deposit, and they took $20 out of his paycheck every month. Just doing little creative things and sharing those ideas with other people on the coordinated entry case conferencing call, so we can make sure that everyone that hits the system can get an opportunity to be housed. For Lincoln, it looks a little bit different. We served 1,478 people within that year. Little bit more rapid, we had 86, or a little bit more permanent. So about 40 people went into permanent supportive housing. I got to count over. And then we are fortunate to have the Lincoln Housing Authority at our coordinated entry meetings every week, and they are able to help us find when people are getting housed so that we can track that data. That was a gap that we had, as Randy said, when we analyze things, that was a gap that we had identified early on, that a lot of people are going off of the coordinated entry order of priority. We don't know where they're going. With the addition of housing authority, we've been able to kind of close that gap so we can know where people are and have more correct data with that. So as you can see, these are kind of the outcomes that we look at to track where people are going. And what I wanted to do is take a minute. We just recently switched to a new homeless management information system database software. We switched to BitFocus Clarity, and that has really, from the Lincoln and Balance of State perspective, and Randy, I haven't discussed much with Stacy about the Omaha Continuum of Care of how BitFocus and Clarity has affected their coordinated entry system, but it has really enhanced the workflow, and we're able to do a lot more with the coordinated entry system. So I wanted to kind of give you a glimpse of what providers are doing and kind of show you that common assessment tool that both Randy and Jeff referenced, as well as how we kind of can see the order of priority and how we reference that and how we can communicate with that during our weekly case conferencing. So as you can see, unfortunately, I hate to tell you guys this, but football season hit. So Herbie Husker, COVID has made him unemployed for right now. So he's hitting our system and he's experiencing homelessness. So we're gonna say that he showed up at one of the public doors. And I'm gonna show you what we do for a quick assessment on him and his son, Little Red. So all providers just fill out this really short demographic sheet. And then what they can do is they can go in and they can enroll him. They're going to directly enroll him after they have him sign the release of information. And this workflow is a little different for Lincoln and Balance of State than it is for Omaha. So just want to preface that for you. So let's pretend like he's in Lincoln, he's in the capital city, and his son, Little Red, they're in shelter now. So we're going to take a look at him and try and get him some help. So we're going to say that today is the first day that he's experiencing homelessness. He's living in an emergency shelter. He's only been there less than a week. So we'll say he hit the shelter on Friday. This is his first time homeless. And this is his first month homeless. So as the providers go through this, they're gathering all of that information that is important for us to keep evaluating. So that we can run reports, find gaps, and then analyze that, figure out what types of interventions are going to be most appropriate in the future if we have any needs or if other opportunities come up. So the common assessment tool that both Jeff and Randy had referenced is found right here. After they enroll them, they will update where they're living at, and then they're going to go in, and in Lincoln and Balance of State, we have opted to use a common assessment tool across both COCs. And at the core of it is what's called the VI-SPDAT, the Vulnerability Index Service Prioritization Decision Assistance Tool. And then we have other additional factors that play into that assessment. So the provider will go in and select the most appropriate. We have one for families, one for singles that are over 24 years old, and we have one for transition age youth. As you can see, in both continuums, we have opted that we don't want the person's blessing or their, yes, I want to take part in this. We're not going to proceed if they haven't given us that. We do have a protocol set up for those that need to remain anonymous for their safety, such as if it's a human trafficking case or if someone is experiencing domestic violence or things like that, and it's important to have their information not shared. We have a protocol for that. But otherwise, we want them to be on, it's a team effort here. So we're going to work together with the client. They're going to give us their release of information to say, yes, I'm going to be active in this. So I'm just going to give you a glimpse of what the assessment looks like. They can choose where they're at. The other thing that's really nice is that we can cross geographic lines at any time. So they are going to also be able to, I'll show you that when we get to the end of it, but they can select to go to other parts of the state. All right, so these are just some of the basic questions. We do a history of homelessness. We look at their risks. We look at their socialization and daily functions. their wellness, and then kind of some other history about like mental health and things. So I'm just going to quickly go through and answer these so you can look at them if you're more interested in really knowing the details of them. I'm more than happy to share a copy of the assessment with you. But I'm just going to quickly kind of go through these so it doesn't take too long. You should be able to, the provider, we were all trained, how many, several long time ago, by Ian DeJean at OrgCode. He came to Kearney. Jeff had arranged for him to come to Kearney and train us. And he said that you should be able to facilitate this assessment in less than 10 minutes, or a lot less than the time it takes to smoke a cigarette. So when you're asking the person, it's not a biopsychosocial assessment that a therapist would do. It is a yes or no, as you can see, and really kind of setting the stage for that for the individual so that they don't have to tell their story again and again is beneficial. We don't want them to go into depth here. And we encourage all agencies that if someone is in crisis, it might be worthy of pausing before they do this assessment, kind of get them at a place where they're okay and safe, and then facilitate the assessment. We've also worked with several of the domestic violence agencies across the state that if someone is in true crisis, like they just have fled and they're really not in a safe place, many of the domestic violence providers will facilitate the assessment alongside the individual. The other thing about the assessment is that it can be updated at any time, because oftentimes we know that life changes sometimes daily, but otherwise we suggest maybe every 3 months people take a look at it and review it. And what will happen is their score will be adjusted according to their vulnerability. Like Jeff had said, gone are the days of the first come, first serve. Now are the days of who's the most vulnerable. The other questions we look at for like veteran status, we look at the military service that they've served, what their discharge status is, just because that could determine some of the veteran resources that are at the table. And we look at foster care because sometimes some of the youth programs can serve people that have been in foster care. And then disabling conditions also can help. We also looked at their length of time homeless. So with Lincoln and Balanced Estate, the other determining factors, we look at the core VI SPDAT score, but then we also look at if they have a disabling condition, if they are a veteran, if they are a transition age youth, if they're actively fleeing domestic violence, they will get additional points for that. And also if they are chronically homeless, which means that they have been homeless for 1 year continuously with a disabling condition or have 4 episodes in 3 years that total 12 months or more, then they are verified as chronic according to HUD. And so they get an additional 10 points. But that has to be verified. We have to have all the documents in line and have them document ready for in the Balanced Estate in Lincoln to be able to get those additional points. So that is the assessment tool that each provider will complete. The provider will save it. And this is kind of my favorite part because it's so streamlined. There's no other tab to go to or anything. There's your scores. You can see kind of where the individual is lying at. And as Jeff was talking about, we want to get them into the right housing intervention. For Lincoln and Balanced Estate, we look at this bottom score to drive the housing intervention. What that means is that we have several different types of housing. Just a quick overview, permanent supportive is longer term housing that people that with higher needs that need more wraparound services for would probably benefit. Many times all of the permanent supportive housings are targeted towards those individuals experiencing chronic homelessness. So oftentimes they'll be paired with that. And so that score would be for a 12 and over for the Lincoln Continuum of Care and a 10 and over for the Balanced Estate. For a rapid rehousing intervention, that's a little bit less case heavy and it's a quicker turnaround. People, the kind of the sweet spot is between 12 and 18 months, people are going to be able to be on their own. However, there are programs that only can assist for 3 to 6 months, some a little bit longer term, and some can have up to 24 months of assistance. Those scores are like between a 5 and a 10 for the Balanced Estate with this core score down here. or for Lincoln, it goes up to an 11. And then all of those that score lower than that, you should be able to, I'm going to quote Ian here. He said, you should be able to hand them a public housing authority application, pat them on the head and send them on their way. So that's what his intervention is for those that maybe have a little bit more self-resources or are less vulnerable and there might not be enough resources to serve them. Below this, you're going to find all of the continuums, all of the areas across the state. We have several different community queues. So for example, Region 1 is our area out in the Panhandle. Region 2 is North Central. Region 3 is the Southwest queue. Region 4 is the Southeast queue, like the Crete, Beatrice, York area. Region 5 is the Northeast queue up by Fremont, and then the Lincoln. So this guy, Herbie, he's hoping that come around fall, football will be back and he can get his job back and he can work again. So I'm going to say that he kind of wants to stay in Lincoln. We do have a general queue, or someone's like, I don't know, I just want to get out of here where I'm at right now. And we really case conference those heavily and try and narrow down where are the resources and where can he go realistically. The other piece that as we bring on prevention, when people do those assessments, if the individual is not experiencing homelessness, they're going to be able to select that program right down here and connect them to a prevention program, which is going to be really handy. They'll use a different assessment, but it'll be a really nice, easy feel for it. So then we're going to refer to the queue. And then what we can do is say, hoping to get his job. We send the referral, and then I'm going to show you what the queue looks like. It's really streamlined, and this is what we use for our case conferencing every week. We go over to the community queue, and we can click here, and we'll see Herbie Husker is here. And then let's say that Community Action Partnership of Lancaster Saunders has a housing opportunity. We can go and we can just make sure that he's the top priority for their program can only accept families. So I'm going to screen by families. He is the only family on the list. His score is here. If there were more families, it would be from top score down to the bottom score. He's the only one. So then during our case conferencing, we can either come in here and make any notes like, hey, who has had the last contact? We're trying to get a hold of him. If that person referred him, it'll show up in their mailbox up here of saying, oh, wait, I got a message on the guy I referred. And then they're going to be able to follow up. Otherwise, what I can do is just connect them with the housing program and send it. And then it's on the agency's pending tab, and the agencies are learning that they need to check that pending tab pretty regularly for all new referrals. So, and then this is where they can kind of track their progress on if he's located an apartment, if he's agreed to be a part of their program. Once we make this connection on this part, it's just saying, hey, this is the next person in line. Take a look at them. So that's what the workflow looks like. Anything else, Jeff or Randy, that you want to add? I know Omaha's workflow is a little bit different, but overall it's kind of the same. They use the community queue and things. So, and we communicate back and forth. We have several people that end up in Fremont or in Lincoln that are like, I need to get back to Omaha. So I'm constantly emailing Stacy, not constantly, but maybe 2 or 3 times a month. Hey, we got someone that wants to come back to Omaha. Help us out. So it's nice to be able to partner together.
No, thanks. That was great. And yeah, the end goal, as Denise was saying, is make sure we get folks into a housing solution as quickly as possible, and a housing solution that's going to end their crisis for as long as we possibly can, as Randy was mentioning, and they never return to the homeless service system. That's the end goal. So I think John and Robin, we're done with our presentation, and we'd be glad to take some questions if there are any.
There we go. Okay, great. Thank you very much. It was great to see that step-by-step, Denise, of how that process works. I often talk about coordinated entry, and it's just good to see, especially with the new system that you guys are using, how streamlined it is, how everyone's kind of collecting the same amount of the same information. One of the things I also want to just tell all of you guys is how incredible your leadership and your collaboration is across the state with all of these agencies. This has been a ton of work. I remember before coordinated entry, and I watched it grow And so the fact that you have your finger on the pulse of everyone in your community, and the amount of collaborative partnerships that you've built across the state, I think is just fantastic. And I'm glad that that this webinar is going to be on YouTube, because I'm going to be sharing it a lot with folks that weren't able to attend today. I also, I wanted to talk a little bit. I love, Jeff, your gone are the days of first come, first serve. That's it's a great quote. I remember when I was a housing provider, and we shifted from me not choosing who I was going to house, but the community choosing who was going to be in my program. And that at first it was a little scary to allow someone to say, okay, this is the next person you're going to house, someone who I hadn't met or I hadn't screened. But ultimately it kind of released that burden, because Denise used to tell the story about how, you might have a guy that comes into your office and you think, well, that looks like a good candidate, I'm going to go ahead and house him. You had one voucher, and then the end of that day, there was someone else that came through that, was most vulnerable, and maybe they even died, a week after you made that decision. And so you housed somebody, you thought it was the right decision, but you didn't realize there was someone more vulnerable that really needed that housing first. So it releases that kind of tension that of you being the only person to make that decision. When you have a community deciding who to house, that that's the right person to house, because everybody's seen that list and has made that. So anyway, I think that's just fantastic. So the other thing that's great is, because of all these collaborations, all the work you've done, the research you've done, now we're better prepared for this huge amount of CARES Act funding that's coming. So what would you like to tell us about the CARES Act money that's coming through Nebraska? It's a lot.
Well, I don't, specific to coordinated entry, we probably ought to stick with that, because, and I kind of referred to that when I was talking, part of coordinated entry is, a key part of it is the prioritization. When resources are extremely limited, as they have always been in the homeless service system, prioritization is huge. It's just what you were talking about, John. It's critical that we identify the person that needs it the most and get it to them. Particularly with some of the prevention resources that are coming in, prioritization, as the HUD SNAPS office has indicated, and you can speak to this too, Randy, is we need to look at our coordinated entry prioritization process and make sure it's meeting the needs that we have right now. It's not a static system. We're always going to be adapting that prioritization process that Denise just went through, and we need to do that now in response to COVID, in response to the economic crisis, in response to the resource pool that we have now. And then when that resource pool changes again, we're going to have to do it all over again. So it's never a static system. Randy?
No, I would just really echo that. We are in the process now of making some amendments to our prioritization policy based on COVID-specific issues. It'll probably be like a 90 to 120 day kind of change, just specifically for that. And in the prevention piece, the housing problem solving that we had built out, we're continuously looking at that and considering adjustments to it as well. It's really that whole process of matching people to the right to the right intervention. I kind of like the analogy of a hospital. So coordinated entry is kind of like that emergency room where you get triaged, assessed. You may receive a lot of treatment, or you may get referred back out to your doctor in the community. It's kind of the important thing of matching people to the right place. So if you have a heart attack, you don't want to get sent to labor and delivery. Yes, labor and delivery has doctors and nurses, and they know kind of what to do and to treat you, but may not have all the resources necessary to really do the best treatment for a heart attack. And so it's kind of that matching someone's individual needs to the appropriate intervention.
Yeah, very good. It looks like we do have a question here. It says 2 questions. what percentage of enrollees are not housing stable? For example, no relative consistent address, or has an address of a provider. And then the second part of that is, does the HMIS system have a dashboard to target community services at a micro community level? That's from our friend Kurt Elder.
Hey, Kurt. I think Randy and Omaha is more developed on the dashboard side, the forward-facing dashboard at this point. I'm not sure about a micro level. As you know, I think Kurt, most of our data, our standard data are at the continuum level, and in Nebraska there are the 3 continuums: balanced estate, which is everything outside of Lincoln and Omaha, Lincoln, which is the city of Lincoln, and as Randy said, Omaha, which is Douglas and Sarpy County, and Pottawatomie in Iowa, they also cover. But yes, we have the ability to do that. I know Balanced State and Lincoln, we are working on a public-facing dashboard, and Randy shared the link to his public-facing dashboard on his slide, if you want to put that out there.
Oh. You want me to share it with, here we go.
Yeah, I would say it may not be completely up to date because of the change in homeless management information systems that we went through a couple of months ago, and still, working on all that migration and everything. But yeah, you can certainly look at it and kind of track it over time to see if there are changes or how things change.
I was just trying to share your screen, Denise, but I'm unable to do that. You're not on my list here.
And then on the second question, or the first question, John, yes, we have data, and some of it where Randy presented in his, on a number of individuals presenting and their current status as they present. So yes, we have that information, Kurt, and we can provide it as needed.
All right. Do you want to follow up any more with that? I have another question from another friend. Should I keep going? Okay, so John Trova, he asked a great question, and I kind of want to direct it to Denise because we've talked about this, but how do you go about moving provider mindset to the one door and using a common assessment instrument? I know you probably all have lots of stories about introducing this concept, but getting people to buy into that.
Well, I share that I was that provider, and I remember you and me having that conversation, John, of, this is nuts, and how scared we were. When Jeff and Brad came back from the National Alliance meeting, that I was like, this is never going to work. So I'm kind of like a peer, and I kind of just share, I was there, and I was scared, and it ended up being okay. I did not have to manage my wait list anymore, which was a huge chunk of my week. So I share that side of it, that I was there, and now I'm working as the coordinated entry manager because I fell in love with it. I'm like, I see the purpose, I see the benefit of it. That's why I wanted this job, So I share that. That's, John, I used some motivational interviewing there. And I also kind of will challenge the providers to say, just because someone's lucky enough to cross your doorstep, does that mean they have the right to the services over the person that doesn't know about you? And just kind of challenge that thinking a little bit. I love our providers, and I feel like, I feel like most of them, I can have that frank conversation to think about it, I remember meeting with one of the providers, and I said that, and she was like, oh, Denise, I never thought of it that way. She's like, dang it, thank you. So just trying to really show them, we are here to serve the people, and really reiterating that, what's best for the people.
Great.
I hope that's a good enough answer, John. That's what we've done.
This is another question, and actually this another one, a follow-up from John. We all know, not all of us, the panelists and myself, we know about the high cost of homelessness. We know there's a story that Malcolm Gladwell wrote probably over 10 years ago about $1 Million Murray, about a homeless gentleman that cost $1 million to the system because of emergency rooms and jail stays and ambulance and police interaction, and how much actually by housing a person you can save money. In Lincoln, we did some studies, and it turns out that a homeless person might cost the system about $35,000 a year in all those different interventions. In some situations, probably a lot more. But if you house them, it's about, and give them a case manager, it's around $16,000. So it's a cost savings. So John asks, do we have an estimate of the lives saved and the health cost savings across the system because of the ability to serve the most vulnerable? I guess we have that little study, but we're still learning, right? Do you have any, are you using any of your data now to assess that any further, any deeper? Omaha or Lincoln?
Just for Omaha, no, we're not yet. I would love to dig deep into that number and work on that. I think you're absolutely right. It's a great cost savings. The only other additional thing specifically that I could add, and it is not relevant to Omaha specifically, but originally I came out of Missouri, and I came to Omaha about 3 years ago. And we did a very specific project related to this and looked specifically at costs to the state health system through Medicaid and Medicare. We were looking at a minimum, and this was for households, for families, but an average of $1,500 reduction in Medicaid and Medicare costs post-housing as to pre-housing. And for single individuals, we were looking at substantial reductions in emergency room and ER visits, something on the order of a population of single individuals at 36 ER visits in the 3 months prior to housing, and then 17 in the year post-housing. And so, those kinds of things just sort of bear out that there really is a significant cost savings for the community with those kind of housing programs.
And for those of you who didn't watch the Housing First Best Practice webinar we did a couple weeks ago, it's on YouTube, and it's 3 projects that have done that and used this data. Go ahead, Jeff.
Yeah, and John, that was from John Truba as well. Just John, and a critical element of being able to do that well is to being able to share administrative data across all our systems. So keep that in mind. That's a huge factor in allowing us to be able to do that, and we'd be glad to have more discussions about that.
Okay, looks like we got a question from Sarah Rips. What do you do with clients who are difficult to maintain contact with? I have clients who are homeless or near homeless, and I feel like once they end up at a shelter, I lose track of them. What tactics do you utilize to make sure they don't fall through the cracks while trying to secure housing?
So in Lincoln and Balance of State, we have the people that screen, and our script that we have written when they go through training, they are encouraged to remind the client, you are a part of this to make this work is that we need you to remain in contact with us, and really encouraging that. And then we do a weekly check-in, and there's a button. I didn't go over that when I was showing you clarity, but when they're on the queue, the people, if anyone has contact with them, they can check them in so that we can see who's had contact, where were they, things like that. And then the notes area just to communicate, like if they show up at agency A, but agency B is who referred them, and they're kind of like, what happened? Then they can see those notes and see that someone had contact with them. The other thing that we do, and this was something that HUD had required, is that we leave them quote unquote live. They're active on the coordinated entry system. They continue to be enrolled. If they fall out of contact within 2 weeks, we put them on a tab. It's called the snooze tab. Basically, they've like fallen out of contact, but they stay there so the providers can easily pull them back in, put a note on, say, hey, we've had contact for 90 days. So we track them for 3 months afterwards to see if there's any activity and who do we need to pull back over. And then once there is activity again, how can we get them linked in if they are the top priority? So that's the interventions that we're doing. A little bit more in Lincoln than in Balance of State. We rely on outreach a lot for that. with those harder clients that kind of that vanish. We rely on outreach to really try and locate them. We also use LPD a lot too, and the jail. They both participate in coordinated entry to help us figure out if they go to one of those, if they have contact with LPD, or if they go to jail. That's what we do in Lincoln and Balance of State. Not as much outreach in Balance of State, so it's a little bit more of a challenge. So.
Great. We have a good question from Vic Clafter. Do any of you anticipate a shortfall of housing units landlords that accept housing vouchers, as there's more funding available for vouchers and more people in need as unemployment continues, state eviction moratorium has expired, and some jobs are just not coming back? Yeah, I know we've talked about that in different meetings.
It's already an issue.
Yeah.
Yes, that's an issue across. I'm sure it's an issue. I've heard Randy talk about it as well, and it's going to continue to be an issue. There are some efforts to try and create some housing navigator type positions. More of those, I think that would help, but that's not going to solve the entire problem. But we really have to get out there and talk to landlords, recruit, use John Turner gumption to get people to convince that they need to rent to these folks to open up their units. It's a long road to hoe, but it's just got to be done and worked through. And to the extent we can get community collaboratives working on that specific issue broadly, it's going to help us all.
Yeah.
I think the one thing I would add to that, and Jeff is exactly right, is one of the things that we really don't want to do is set people up for failure. And what I mean is, you know, the CARES Act money allows providers to pay, you know, fair market rent or what is a reasonable cost for your area. But that may not be something that the family could sustain over the long term. So while the provider, because of the source of funding and things like that, could pay $900,000 a month in rent for a 2 or 3 bedroom unit, the family may not be able to afford that. And so what you don't want to happen is the program can pay that rent for 6 months, 12 months, whatever it is, and then once the assistance period ends, the family just falls back into homelessness. And so it's that, how do we find enough landlords willing to work with folks? How do we find enough affordable housing units to their income level, or get them onto a Section 8 voucher or something like that that will help pick up that rent burden afterwards? But it's going to be, I think we have a huge opportunity with CARES Act funds to get a lot of people who are experiencing homelessness in shelters into housing. It's just going to be finding enough housing units to do it.
Yeah, such an importance to have landlord relationships built and save those relationships. You know, I know that there's agencies that have more of the landlord liaison roles, so they continue to build those relationships, some kind of innovative ways to pay for damages if a tenant damages a unit, so the landlord will stay engaged. But that is a huge piece. We could have all the rent assistance we need, but we need the units to put people in. So working at NIFA, I'm always trying to, you know, learn from other cities about how they're constructing units or rehabbing units. So we have places for people to go. And I know housing authorities have worked really hard with that too, to try to, you know, offer incentives to accept Section 8 vouchers. But it sounds like there's a lot of work, but, you know, efforts like what you guys are doing and that, like I said, that common community that you've established with all these experts is the best way to handle it. I know it's 11:01. Let's see. Do you guys know how the numbers entering the system changed in the last month during this situation? Like, have you seen specifically in the last month?
We did look in Lincoln and the Balance of State at some rental assistance service provision numbers, and bizarre, just to be forthright here, that we switched HMIS systems during the middle of this pandemic was very unfortunate. We would have had a lot better data going through this than we do now. But yes, we have looked at some monthly increases and seeing some monthly increases in requests for rental assistance in May compared to March and February, or March. We can't go back to February at this point. But I think as many people on the phone know, the real hit is starting right now. And I think the numbers we see in June and July are going to dwarf what we've seen thus far. I hope we're wrong, but I suspect we're not. But we are looking at those.
Very good. Well, again, thank you so much, Randy, Denise, and Jeff, for doing this today. We really appreciate it. We appreciate the folks that have joined us and continue to join us as we offer more of these webinars. We have ideas for some in July. And let's see, did I mention? I think I already mentioned, didn't I, Elizabeth, the next week about factory-built homes? Another great way to.
Yes, Factory Built Homes is next week, and all of these webinars are saved on our website. And we also have a Facebook contest going on for Home Ownership Month. So check that out and share it with your community folks.
Very good. Well, thanks to my NIFA team, and we will see you on the next Networking with NIFA and Conference Connection. So you guys have a great day.
Bye. Thank you.
Thank you.
Thanks, John.